This pandemic has shown us how vulnerable we all are. Whether it's India, where the number of cases is currently skyrocketing with over 300,000 new infections a day, or in Europe, which has reported the highest death toll for a long time and where vaccination is still very slow. Everywhere in the world, resources to fight the virus are limited. That is why there are priority lists for vaccination. First, we must protect those most at risk. But are we really doing that? What about children? They're way down at the bottom of any priority list. Besides, there's not even a vaccine available for them yet. That leaves children with special needs especially vulnerable. Welcome to our COVID-19 special. I'm Monica Jones in Berlin. Good to have you with us. And you just have to admire kids and their ability to deal with new situations. I see kids every day on their way to school or in supermarkets with their parents, and they're wearing their little face masks with such ease as if it was the most natural thing in the world. But not every child can adapt that easily. And for some, this virus is an additional risk to an already challenging life.
Physical exercises are important, especially for Flavia. The 14-year-old has Down syndrome. Normally, she doesn't do them with her mother, but her physiotherapist. But since the coronavirus pandemic started, the family has severely restricted their contacts. Because for Flavia, a COVID infection could be fatal.
Eine Infektion birgt bei Menschen mit Down-Syndrom nach allem, was man weiß.
For people with Down syndrome, an infection harbors much greater risks than for others. Additionally, we know very little about long-term effects of this illness. So even if she were to survive an infection, we wouldn't know what would come after that.
Wissen wir einfach nicht, was dann noch da oben drauf kommt.
Therefore, the family keeps to themselves. Physical contact with others is restricted. The children are only occasionally allowed to play with others. School happens online. All of this puts a strain on Flavia. I cried quite a bit because school was closed, so we had to do it digitally, and that was stressful.
Was wir bei Flavia merken, ist die totale Vereinsamung.
We've noticed that Flavia suffers enormously from this loneliness. She sits in her room for hours. She talks to herself more and more. She makes noises. She just isolates herself.
Und verkapselt sich so.
Getting Flavia vaccinated against COVID would help the family. But no vaccine has yet been approved for under 16-year-olds in Germany. Clinical trials are still ongoing.
In diesen Testreihen ist es so, dass unter ganz extrem
In these trials, different age groups are tested under close observation. That way, the researchers can gradually find out how the drug reacts with certain groups. But they haven't finished that yet. So using the vaccine now is a bit like walking into a dark forest, so to speak.
einen dunklen Wald geht, wenn man so will.
The family hopes that this dark forest will clear soon. They don't know when the vaccination will be approved for children. Until then, they will do everything they can to protect their daughter.
And for more, I'm joined by Dr. Anke Hüls. She's Assistant Professor of Epidemiology and Environmental Health at the Rollins School of Public Health at Emory University in Atlanta. Good to have you with us. Please tell us, first of all, how much do we actually know about COVID-19 in patients with DS?
Hi, Monica. Thanks a lot for having me. So up to now, the Trisomy 21 Research Society conducted a large-scale study on individuals with Down syndrome and COVID-19. And what we found when investigating more than 1,000 individuals with Down syndrome and COVID-19 is that individuals with Down syndrome are much more likely to die after having COVID-19 than the general population. So, for example, individuals with Down syndrome and COVID-19, so their mortality rates when they are 40 are comparable to those from the general population who are 70. So they are the mortality risk is much higher than in the general population.
Why is that? What puts them at such high risk?
So that is different reasons. So one thing is that individuals with Down syndrome in general often suffer from premature aging. So for example, individuals with Down syndrome are also very likely to develop dementia at a very young age. So in their 40s, many of them already have dementia. And another reason is that they also often suffer from immune dysfunction. So as an example, individuals with Down syndrome are also, they are known to be more vulnerable to all kinds of respiratory disease and to pneumonia, for example. So unfortunately, it's not surprising that they are also more vulnerable to COVID-19.
Right. So when the mother in this report that we just saw says she's terribly worried about her daughter, you just basically agreed that she has every right to be that worried. How can she better protect her?
Yeah. So first of all, I really want to highlight that the high mortality rates that we observed among individuals with Down syndrome were particularly present for the individuals with Down syndrome above the age of 40. So we only found very few deaths among children with Down syndrome. So it was really, really rare, which is similar as in the general population. So that's at least one good thing. But of course, nevertheless, that doesn't mean that parents of individuals with Down syndrome don't have to worry, because as I already mentioned, death is not the only adverse outcome of this disease, and we still know so little about the long-term effects of COVID-19, and also other respiratory complications might be more prevalent among children with Down syndrome than among children without Down syndrome. So of course, it is important to protect them. But the other problem is that it's also, it's a hard thing to do and a hard decision, because especially kids with Down syndrome, they as we already saw in the video, they really need a special care, not only for their physical health, but also for their cognitive and mental health. So it's always an act of balancing the risks and benefits. And at the moment, our highest chance to really protect them is vaccination.
Vaccination. I know that in the United States, teenagers, at least from the age of 16 onwards, can now be vaccinated. Does this include teenagers with Down syndrome?
Yes, absolutely. So in December, the CDC included Down syndrome as a high-risk medical complication for COVID-19. So, and then in January, when the large-scale rollout started, most states included individuals with Down syndrome in their first or second priority group. So, and since mid-March, early April, in the whole country, individuals with Down syndrome can be vaccinated against COVID-19, and that includes all, also teenagers, so starting at the age of 16. And I know that most European countries are now also vaccinating individuals with Down syndrome, because it is now well known that they are at a higher risk for severe COVID-19. So, so many European countries also vaccinate individuals with Down syndrome starting at the age of 16.
All right, so now we have to look forward to that, and of course to vaccines for children that are even younger than that. But for now, thank you so much, Dr. Anke Hüls from the Rollins School of Public Health at Emory University in Atlanta. Thank you so much for your time.
Thank you for having me. Bye.
And of course, we all hope that vaccination will bring back the freedoms we've enjoyed before the pandemic. For some, sooner than others, perhaps. Time to ask Derek.
Will Germany or the EU be implementing a COVID vaccine passport?
Yes, though it won't be called that, as it'll also document people who've had the disease or have recorded recent negative tests. The EU is moving forward with what's being called a digital green certificate to facilitate movement within the bloc, though it's still not yet clear exactly what rights it'll confer. There's opposition, of course, but But proponents say governments currently really have few other options. After all, long before the pandemic hit, tourism had become a key pillar for nearly every economy on Earth. And the last 15 months have just cut the industry off at the ankles. Europe relies on tourism heavily, and desperate attempts to restart it somehow, some way, have been going on since the very first days of lockdown over a year ago. So what are the issues? Well, there are many ethical questions, but a lot of critics think the most serious is that a certificate could lead to discrimination against people who, for whatever reason, haven't been vaccinated, or at least not yet, especially if the documents are used to limit their activities in their own countries by their own governments. There are also big practical and technological barriers to overcome in implementing certification systems, especially when it comes to data privacy and security. Potential fraud is another big issue. Despite the many hurdles, the plan is to have the program up and running by June in order to make travel between EU member states easier for people who are vaccinated or who have recovered. And not just for Europeans. Talks have also begun with the US about the best ways to allow fully vaccinated or recovered American tourists to begin returning to Europe.
That's all for today. Thanks for watching.